your health insurance is currently making your healthcare more expensive, not less. That's not a billing error. It's a systematic reality where cash prices were lower than median insurance paid prices for 47% of shoppable healthcare services across 2,379 US hospitals. When you pay through insurance, you're not just covering your medical care. You're funding an entire ecosystem of middlemen who inflate costs at every layer. But here's where that middleman system becomes a pricing factory designed to extract maximum revenue from every transaction. Hospitals operate two completely different pricing structures. Cash prices average 64% of chargemaster rates, while commercial negotiated rates sit at 58% of those same inflated list prices. Think of it like a department store that marks everything up 300%, then offers insurance companies a generous 40% discount. You're still paying double what the item actually costs. This creates a self-reinforcing cycle. Hospitals inflate chargemaster prices because insurers negotiate discounts. Insurers demand steeper discounts because chargemaster prices keep rising. Hospitals raise prices further to preserve revenue after those discounts. And the cycle repeats. A peer-reviewed study tracking over 3,400 hospitals found chargemaster markups increased 155% between 1996 and 2017. The insurance discount becomes an accounting trick. When your insurer negotiates a 55% discount off a $12,000 procedure, that sounds generous until you realize they're taking 55% off an inflated list price. The final negotiated rate of $5,416 is still 4.2 times what Medicare pays for identical services. You're not getting a deal. You're funding an elaborate markup scheme where every layer of administration adds its own profit margin to your medical care. Given that your insurer's generous 55% discount still leaves you paying over 4 times what Medicare pays for the same procedure, have you ever asked your doctor for their cash price before using insurance? Drop your answer in the comments below. Now, let's look at what happens when patients actually start doing this math themselves. Direct primary care memberships cost $92 per month nationally in 2026, with a median of $80, unlimited primary care access for less than most people spend on their phone bill. When you call a hospital before any procedure and ask for their self-pay rate, you access that hidden cash pricing tier where cash prices average 64% of chargemaster rates. Health savings account funds now cover direct primary care cost payments starting in 2026, reducing membership fees by 22 to 37% through tax savings. The psychological barrier isn't the money. It's the feeling that you're wasting your insurance premiums. But those premiums are sunk costs, like paying rent on an apartment you can't escape. You're not throwing money away by paying cash. You're cutting your losses on a system designed to extract maximum profit from your medical needs. This isn't about becoming uninsured. It's about understanding that you have pricing power the system doesn't want you to discover. When you ask for cash prices up front, negotiate payment plans, or join direct primary care practices, you're stepping outside the markup machinery that turns a $3,000 procedure into a $12,000 insurance transaction. The insurance industry has spent decades convincing you that their discount is generous, but you're actually paying the premium to fund their entire administrative empire. Subscribe for more healthcare system breakdowns that expose how insurance middlemen inflate your costs. Next, prescription drug pricing loopholes.